Before you begin, here are some tips to help you view the material. From the play bar, use the control buttons to navigate through the module. The module contains audio. You may turn the audio off by clicking on the speaker icon in the lower right-hand corner. Pressing the F11 key will display in full screen mode. Please click the Continue button when you are ready. Welcome! Today we are going to walk through the workflow of documenting risk stratification in ECW. After completing this tutorial, you will be able to describe the CPC initiative, define the 3 patients' risk levels, and explain the workflow for documenting all patient risk levels. The Comprehensive Primary Care Initiative is a multi-payer initiative fostering collaboration between public and private healthcare payers to strengthen primary care. Here at HealthQuest, 6 primary care practices were chosen to participate in CPCI. As part of this initiative, we are developing processes and improvement strategies to help patients achieve better health and provide better health care at lower cost. Risk stratification utilizes risk assessment criteria to help determine the level of care each patient requires for them to obtain optimum health. Based on the outcome of the risk assessment, a personalized care plan can then be developed by the care manager and the provider in collaboration with the patient and/or family. The identification of patients' health risk category is the first step towards planning, developing, and implementing a personalized patient care plan by the care team. Using the risk stratification criteria, nurses will stratify patients during their office visits. ECW workflow. Let's take a look at documenting the risk stratification in ECW. So you are going to open up the patient's progress note. Today we're going to use Minnie Mouse, and we're going to go under the social history area, and you'll see that under social history there's risk stratification. We are going to click in the details section of risk stratification, and that's going to open up a pop-up which is going to allow us to enter in the structured data. So the date completed when we click in this cell will already populate with today's date, and then we make the determination whether the patient is risk level 1, 2, or 3. For today's example, we're going to say our patient is risk level 1, so we're going to click in this cell, and then we're going to make our selections from this pop-up. Now we can make multiple selections, or we can make a single selection. So I am going to show you both. You can just select 1 or 2 or 3 or all of them. So we'll choose those 3. We'll choose Add. It populates the cell, and then when we close our windows, you will see that it puts the risk stratification date completed, risk level, and the selections you made under the social history. Changing or updating a patient's risk level. A few tips for changing or updating a patient's risk level. So we are again in Minnie Mouse's progress note, and we can see under her social history that she is a risk level 1. We are today going to change her to a risk level 2. To do that, we're going to go in under the social history. We're going to go in under the details of risk stratification, and we can hit this Clear All button. And then we would click at the date completed. It would default to today's date. And she was a risk level 1. We're going to make her a risk level 2. We're going to click in the risk level 2. We're going to make our selections. Click on Add. Click on Close. And click on Close, and you'll see in the social history section she has now been changed to a risk level 2. So providers, nurses, and care managers can risk stratify patients, or they can change the patient's risk level. For Level 1 patients, we should risk stratify annually. For level 2 patients, we should risk stratify semi-annually. And for risk 3 patients, we should risk stratify quarterly. When risk stratifying a patient who presents conditions under multiple risk levels, document under the highest risk level, not both. In the example below, the patient presents conditions under both risk level 1 and risk level 2. In ECW, document the patient at the highest risk level 2 only.